did share the rate of growth, and it was a pretty dramatic growth rate. And in that, while you were talking about, Deborah, while you were talking about that slide, you had mentioned that there's an attrition rate. Have you monitored the attrition rate as the program has grown to ensure plan fidelity to the plan?
Yes, we have. I mean, we've noticed particular periods when clients tend to drop out, and often, you know, between year 1 and year 2, when the child turns 1 and 2, there's a change, and also right after when she gives birth, and after about 2 or 3 months, and especially if a mom goes back to work, which is great, or goes back to school, then there are issues of when she can see the nurse. So we've looked at that, and we've actually looked, and with the nurses, there's been training and discussion on what are the kinds of incentives, not monetary, but sort of motivators, and motivational counseling is an area that the national office is promoting and that we're working on as a way to identify those risky periods and for the client to still feel that she needs this program and that she can benefit from it. So we are watching it. We compare ourselves, we get data every month from national, and we're compared to national, so we can also see how we're doing in comparison to national. And we're doing a little better in the first, during the pregnancy period. We're doing about the same in the other period. So we are aligned with what national's experience is. That's a really good question.
I think Janet had a question.
I think the program sounds absolutely wonderful, and I'm envious that we don't have it in Westchester County. But I have a question, I guess it's a policy question. You're limiting to first-time pregnancies, and I'm picturing a teenage mother who perhaps was unaware of the program, already has a child, has a second child, and she's apparently lost that window of opportunity that would allow her to participate in this program. What's your thinking on that?
We work with other organizations in all the communities where we exist to refer women that are in their second pregnancy to those programs. We have no data from our program that it would be effective with second births, and so we don't offer it to those women.
I guess from the perspective of available high-quality nurses. And we haven't heard anything, or at least I might have missed any kind of comment about what kind of attrition you have with the nurses, how you are measuring their effectiveness, not just fidelity to the program, but you know, are they good at what they do? Are they accomplishing what they need to accomplish? Because they can't all be perfect, I'm sure. So, you know, I have concerns about availability of nurses and, you know, coming out of nursing school, and then availability of good nurses and how you do that quickly.
I'm just going to offer one initial comment and then turn it over to you guys. But nationally, if we currently serve about 18,000 people per day. Our business plan calls for an expansion of that over the next 10 years to serve 100,000 people per day. And even at 100,000 enrollment per day, we would be using 0.25% of the national nursing supply. So in terms of the supply numbers, they're there, and then we don't think we're going to make, have a measurable dent on that supply, but locally there are going to be issues in.
So I'd say when we started, we had two major challenges. One was recruiting nurses, and two was recruiting clients. You reach a tipping point when the word of mouth is good enough that people start hearing about this program from others. And we are at that tipping point now where we were getting 2 or 3 nurse applications a month, and we were freaking out. Full-time nurse recruiter, because our HR department wasn't able to focus, they were dealing with the whole city and hiring, and they didn't have the resources to hire someone. We hired a full-time nurse recruiter. We're now building relationships with nursing organizations, etc. And we now have dozens of applicants every month from nurses. So I think what's happening is, as nurses hear about this and they know other nurses, and we have nurses who can talk about it, there's a sense of, okay, this is, when there's only a few people doing it, you feel like this is kind of risky to do this. I don't know anyone who's doing it. There's only 5 people doing it. Now there's 120 nurses, either supervisors or frontline nurses, doing this program in New York City. And people feel, I think, a lot more confidence. I think also having organizations that are so known to nurses. VNS has been a great addition for many reasons, but one is the reputation around nursing. That really strengthens. So so that's one in terms of the recruitment. It takes time. you hit a tipping point and the word is out, and then people feel like, okay, this is a legitimate, and people have had it sometimes working in a hospital setting, they have families, they want a more normal schedule, and so it's often a perfect position. And then the other on monitoring, and you can talk to it from the local level, we take that very seriously. Yes, not every nurse is perfect. There's some nurses that this hasn't been the right program for, and they've left, or have been asked to leave. And that's you know, sometimes but we really learned from that how to do our hiring in a way that we believe we now weed out people who this is not for before they're hired. I mean, at the beginning we weren't as good at that, and we got, you know, now our nurses say, I can spot an NFP nurse, like I know right away that's an NFP nurse, or that this woman is not going to be happy. And they are all women. So I think we've learned more about who is this the right program for from the nurse's point of view. And then we have a whole QA, we're working and growing and improving our QA with policies, procedures, with oversight. The nurse supervisor has case supervision every week with each of her nurses and case conferences as a group. The nurse supervisor goes out and does site visits, and that's a good segue to you.
Definitely the ability to continually monitor our nurses from a perspective of having what we call reflective supervision with them on a weekly basis is important to maintain a contact with them. Personally, for myself, the team that I have, I took out each and every individual nurse prior to their hire, and I took them on field visits so that I got an opportunity to see them in the field. And I'm expected to go out on 2 supervised field visits with each nurse every 4 months. And I meet with them every week for an hour, each of the individual nurses. So I have a very good sense of who is doing what and how they are dealing with the program. And I just simply ask them, you know, it's the most effective way. Be honest with them. Are you having any problems? What, you know, what can I help you with? Yes?
This is just to add to that, the program that we're starting to work on with University of Pennsylvania, part of that is there's a mentor component so that they will spend time with NFP before starting to actually work there, so that they make sure that it is the right fit. And it's good, I think, on both ends, for the nurse to experience the program and for the NFP you know, folks to make sure that it's the right fit on their end. So, and I think as that program grows, the idea is to start it at University of Pennsylvania and then replicate it at other nursing schools, and so that hopefully down the line you'll be able to get, you know, a decent amount of the nurses through that program where they have that experience.
I think we have time for one more question. The woman in the blue has had her hand up for some time.
Thank you. I'm just wondering about father involvement, if that's sort of a business, and if you're tracking that.
I didn't mean to ignore them because they're a very important part. We have a fatherhood program that is overseen by.
Is that here or is it nationwide?
This is for visiting nurse service
I
of
know
New
New
York.
York is a big thing, I'm just wondering.
Oh, nationwide.
Oh, nationwide?
Nationwide.
Tamara?
Nationwide question
Tamara?
tomorrow.
Nationwide fatherhood?
It's a key focus of the program. There's increasing focus on it nationally. So, I mean, I think it's recognized. It's been an important part of the program from the beginning. I've actually talked with a number of fathers and know that the people who are working on the program at the national level are continually working to improve that component. It's key.
Oh.
I mean, it was quite phenomenal at the graduation in the Bronx with the 25 first graduates. At least half the dads, I would say, were there.
And the program that we have, the Father's First program, really incorporates the father from the very beginning. It gives the father strategies to recognize a woman, what she's going through hormonally and physiologically during the early, middle, and end stages of pregnancy. It the program also gives the father an outlet to be one-on-one or in a group with other gentlemen that are going through the same situation. It provides peer support, job counseling, educational referrals, so that the father really is integrated into the pregnancy so that he has a vital role. And we actually have every spring a program where the fathers get an opportunity to come down and share. We choose 1 or 2 that come down and share their experiences. And they will tell you very honestly, I didn't know what was going on. you know, because women's hormones, you know, when you're pregnant, it just goes crazy. So they got an understanding of, and they were better able to cope, and they're better fathers.